Welcome back to Decoding AI for You, the 5-minute deep dive. If you are looking for smarter, more effective ways to deliver better care to your patients, you will want to listen up. I've been exploring how generative AI, yes, that same tech you've probably heard about for writing essays or generating images, is quietly but powerfully transforming clinical dentistry. And I want to share what I've learned. At first, I thought, AI in dentistry? That's probably limited to scheduling tools or maybe some back-end support. But what I found was way more exciting. Generative AI is starting to show real potential in clinical areas: preventive, restorative, and even cosmetic dentistry. Let's start with preventive care because that's where we can make the biggest difference early on. Imagine AI analyzing anonymized data across thousands of patients, X-rays, treatment notes, even 3D scans, and flagging people who might be at higher risk of cavities or gum disease before there's a visible issue. It's not guesswork. It's predictive modeling based on real patterns from real outcomes. And it doesn't stop there. The AI can actually help tailor a prevention plan. So instead of telling everyone to just floss more, I could see specific recommendations, maybe a particular fluoride treatment combined with more frequent cleanings for that individual patient's risk profile. That level of personalization, it's a game changer. Plus, AI helps keep patients engaged. It can automatically generate reminders, clear explanations of care routines, or even detect patterns like patients who frequently cancel. That could mean anxiety, or maybe trouble getting time off work. Either way, it gives us a heads up to intervene and keep them on track. Now, onto restorative dentistry. This is where I've seen AI step in as a kind of superpowered assistant, from reviewing patient histories and images to suggesting tailored treatment options, fillings, crowns, implants. The AI helps me make faster, more informed decisions. It's not replacing clinical judgment, it's enhancing it. One of the biggest boosts comes in diagnostics. Think about how hard it is to catch vertical root fractures or pinpoint early-stage cavities. AI trained on thousands of dental images can pick up those tiny details, sometimes better than the human eye. It's like having a second expert opinion right in the operatory. And patients love the visual aids AI provides. When I can show someone exactly what the issue is and what the solution might look like, their confidence in the treatment skyrockets. It improves trust, speeds up decision-making, and in some cases, helps us opt for less invasive procedures. Cosmetic dentistry is seeing a big leap too, especially with generative AI. We can now simulate potential outcomes with incredible accuracy. Imagine showing a patient a realistic preview of their smile before starting veneers or whitening. No more relying on vague descriptions or stock before and after photos. It's clear, it's visual, and it puts us and the patient on the same page. And generative AI can help nurture patient relationships after the consult too. If someone inquired about teeth whitening, the system can later send them personalized follow-ups, tips, offers, even long-term maintenance reminders. What I really appreciate is how AI doesn't treat cosmetic dentistry as an island. It connects with the patient's full treatment history, restorative, orthodontic, surgical, to ensure any cosmetic work is built on a healthy foundation. Now, I won't sugarcoat it. There are ethical considerations. We've got to be transparent about how we use AI in our practices. Informed consent needs to be rock solid. Patients deserve to know when AI is involved in their diagnosis or treatment planning, what it does, what it doesn't, and how their data is used. Data privacy is another big one. AI thrives on data, but we have to protect that information with the highest standards, whether it's HIPAA, GDPR, or whatever applies locally. Secure storage, secure processing, it's non-negotiable. Bias is also something we need to stay on top of. If an AI model is trained mostly on data from one demographic group, it might underperform with others. We need fairness, transparency, and human oversight built into every step. Looking ahead, I'm especially excited about how AI can reshape dental education. Imagine future dentists learning on AI-generated virtual patients, complex cases simulated with full interactivity, or large language models creating dynamic assessments tailored to specific learning objectives. We're talking simulation tools like a flight simulator, but for dentistry. Even practice operations could get smarter. Think about AI transcribing patient calls in real time, flagging symptoms or concerns for follow-up, or summarizing conversations so staff are instantly briefed. That's what I mean by freeing up human time for high-value care. Of course, it's not plug and play. Integrating AI with existing practice management systems, imaging software, it's a technical challenge, but with the right infrastructure, open APIs, better interoperability, we'll get there. If you're ready to take the next step, check out the resources in the description, which includes our deep dive report, provides a detailed analysis on generative AI within your industry. And as always, stay curious, stay informed, and I'll see you in the next episode of Decoding AI for You. Thanks for watching Decoding AI for You. If you found this useful, don't forget to like, subscribe, and share. Let's keep exploring the future of AI together. See you next time.